and welcome to another edition of Glaucoma Fast Facts. What would you recommend as some good questions for a patient to ask his or her doctor to better understand their glaucoma?
That's a good question. So I think that it's really important for patients to understand what kind of glaucoma they have. Asking the doctor, typically is it open angle or closed angle or any kind of special nuance. So what kind of glaucoma do I have? And it's also, I think, a good idea for you to ask the doctor, what's my goal? Okay, what's my target? Typically, when we as doctors evaluate a patient for glaucoma, we usually evaluate the eye, but then we have to kind of get a sense of how much lower are we going to want the eye pressure to be, because that's the way we actually treat glaucoma, by lowering the eye pressure. By lowering that eye pressure, we're reducing stress on the optic nerve, and that's what helps to preserve it. And so we typically want to find a kind of a goal of where we're looking for your pressure to go down to, where we think that it will be safe for us to try to preserve your vision and stabilize it. So having an idea of what your target is a good question to ask, so that you can, along with the doctor, feel like, okay, my treatment is working well and I'm at my goal, I'm at my target, or even under my target. And when you're not under your target, it can help you to kind of understand why the doctor might be needing to be more aggressive or needing to change things, so that you can understand that they're trying to maintain something, and if they don't, that's the reason why they're changing things. So that's another important question to talk about. Another thing to ask the doctor is, how often should I be following up? Sometimes that level of follow-up has to do with how stable you are. If you're not really stable and there are things that are happening, you would likely be seen more often. Sometimes it could be every so many weeks, especially if you're a post-operative patient. But as you become more stable, it could be maybe every 3 months, 4 months, maybe 6 months. That typically is depending on what stage of your glaucoma and how stable it is. So how frequently should I be following up? And that goes to, making sure that if past that, like if all of a sudden, appointment was changed and you hadn't followed up and it's now a year, you need to know that you need to get back to see that doctor to follow up on the glaucoma. So those are some important questions.
And what would you recommend for patients who, despite the best treatments, are still experiencing some vision loss?
So we know that glaucoma is a disease that can cause there to be blindness. But we know that our treatment options can help slow that down. But unfortunately, patients can still lose some vision. And what's important is to try to get as much help as possible. So for example, if you reached a stage where you have low vision with your glaucoma, one option is that you can see doctors that are called low vision specialists. These are typically optometrists who are specialized in being able to help the patient with improving your vision with aids. Aids like magnifiers. There's even different types of equipment, even up to like a TV-like equipment that can magnify to help patients with the tasks that they need to do. Maybe writing bills, or maybe reading a newspaper, or being able to do something specific. These doctors can help patients to find the tools in order to get those tasks done. Also, I think it's important to know, because glaucoma can be a very lonely disease, because you can look fine, but you're not seeing the way other people in the world might be seeing. And so it's good to find support. That support can come from people that you might even meet in the office setting when you are say for example, my glaucoma clinic. Some of my patients will start to have conversations with each other because they have something in common. There are also sometimes support groups that you can find online. There are glaucoma support groups in Facebook and Yahoo groups. Sometimes there's local support groups through maybe the clinic that you go to, or like the Lion's Eye Club. So there are different areas, and I encourage that support, because one needs to know that you're not alone, that there are many people who are going through the same things as you're going through. I actually have a book that's coming out called the Glaucoma Guidebook, Learn the Risks and Save Your Sight, 12 top tips from an expert myself on helping to prevent blindness. Now in this book, I share one chapter talks about the Glaucoma Caregiver's Guide, because one other aspect of glaucoma is trying to share it with the people who are around you. And sometimes it can be difficult for them to understand what you're going through because, like I said, look normal, your eyes look normal, but you're not seeing the same. And so sometimes they wonder, why can't you see that? If you can see this, but you can't see that, why is that? And so this section of the book kind of helps those caregivers or family members to understand what glaucoma is like through your eyes, and gives them some suggestions and tips on how to help to relate with their family members that have glaucoma, so that they can be more compassionate and understanding, and just kind of have a better idea what's going on with your world.
Thank you so much, Constance. And for more information, please visit our website, glaucoma.org, and download our 40-page booklet, Understanding and Living with Glaucoma.